So today I talked about treating keloids, and I tried to boil it down to what could be said that was useful information in a 15-minute period of time. You can't talk about the treatment of keloids in 15 minutes. There's just not enough time. So I thought I'd separate it into a couple of tips that I've learned over the years. I was never taught how to treat a keloid. It's not something that was part of the curriculum back when I was in residency. I ended up becoming a professor at a university that had a predominantly Caribbean American population. So we saw a ton of keloids and something had to be done. So you just sort of took a stab at it. The data for treating keloids is horrible. I gave an entire lecture today and not one reference was at the bottom of any slide because there are no references for virtually any of this. All of it is opinion from people who spend a lot of time treating keloids. So, corticosteroids, clearly your best friend. Make sure you use nice high amounts. You inject from the side, not from the top, because otherwise you're dropping it down into the subcutis. Very important that you're treating only a few lesions at a time. My first question that I ask the patients who come in with multiple keloids is, where are we going today? What is it that you want to treat? For whatever reason. It's too big, it itches, it hurts. That's why you're here, that's why I'm here, and I inject only the spot that they tell me to inject that day. Because what this is about is not eradicating a keloid. There is no such thing as eradicating a keloid or giving somebody normal-looking skin. I'm trying to make their life better. And in order to make their life better, I need to know what they want. Do they just want to stop itching? Do they want to stop hurting? Do they want it to be flatter? Because I can't make it flat. And those are all questions that we need to consider with every patient. I guess the other important tip that I gave today is don't worry about how big a keloid is. Almost every keloid is smaller in its attachment to the body than it is in its bulk. It's like a mushroom. The top might be huge, the attachment to the skin can be very, very small. So it looks terribly daunting when they walk in, but if you pull the keloid aside, you realize all you need to do is shave that sucker off. And the patient will look dramatically and instantly very, very much better. And they're very appreciative. So you don't have to go for perfection when removing a keloid. The patient will be quite happy if you end up with an improvement in their appearance and be very satisfied with your care. But crucially important, when you do an excision of a keloid, it must be followed up by comprehensive adjunctive therapy. Otherwise, that keloid is going to regrow and regrow larger than it was before. Fortunately, we have numerous adjunctive therapies, including interferon and radiation therapy, and of course, corticosteroids, to try to help it so that we make sure that this keloid does not come back.